Hi everyone. I recently had a question that I wanted to answer in this vlog for this newsletter. A lot of people have asked me in my entire 12 years in doing what I do in my innovative and really unique approach to optimal health and living, and that why I see so many children, why I work with so many children. And someone recently said, man, do a lot of kids have back problems or something? Because I see a lot of infants and children. The reality is that I've seen hundreds of children less than a week old, and more than a third of my practice is under the age of 10. And I want to talk a little bit about this. If we think about health and well-being, you have two choices. One choice is that you invest in your health and your overall well-being up front to maintain a high quality of life through your entire life, or you invest a lot more time, energy, and money and create a lot more heartache and stress for yourself, your friends, and your family from the back end when you actually experience disease and illness. Think of it like this. We've been educated to understand dental hygiene. We understand this. Every year, once or twice a year, regardless of how our teeth actually feel, we'll go see our dentist and we'll get a dental checkup, we'll get a cleaning. This is a good thing. We understand that dental hygiene is a good thing for our overall health and well-being. I lead a new idea in the next phase of understanding health and well-being, and this is the reality of it. We have a master control system in our body. It is called our central nervous system. It consists of our brain, our spinal cord, and all the nerves that go out to the body. 90% of your central nervous system is located between your brain and your pelvis, down in your body. That's why when I work on people, that's where I do most of the work. Now, in our present healthcare model, if you have an ache, pain, illness, disease, anxiety, depression, cancer, whatever it is, we focus on treating the symptom, the effect, and the pain through drugs, radiation, surgery, and other methodologies like that. And that's absolutely necessary during times of trauma, because that may be the thing that prevents your death. However, there's a strong difference between preventing your death and increasing the expression of your life. Your master control system, your nerve system, sends all the messages to every cell, tissue, and organ in your body. If it's flowing 100%, you have 100% communication, and every cell, tissue, organ is healthy, happy, vibrant. If you have less than 100%, you're not healthy, happy, vibrant. Why do I see children? I see children because their parents understand that the key to health is having a healthy central nervous system. And regular checkups and getting checked has to do with getting adjusted and making sure my innovative tonal approach ensures that life force flow is flowing through your central nervous system at 100%. How do you know if your nervous system's not flowing at 100%? Whether it's you, your family, your children, your spouse, your colleagues, coworkers, or your friends. If you have aches or pains, it's not. If you have illness or disease, it's not 100%. If your kids are cranky and upset and aches and pains and low immune systems and they're always sick, not 100%. So you have a choice. You can do the things that cultivate and nurture your body's intelligence, which flows through your nerve system, so you don't have to live with the uncomfortable effects of that, or you can pay for it from the back end, treating the effects, allowing those interference patterns to continue to build. Think of it this way. If you have a friend that shows up at the airport and they call you for directions to your home and they can only hear 50% of what you're saying. So 50% of what you're saying to get directions to your house, they're gonna have a really, really hard time showing up at your doorstep. If you have an ache or a pain or something's not right in your body, your nerve system is working at about 40 or 50%. So naturally, your cells are going to begin to misbehave because they don't have the right information. These children I work with, they're our future. These children are the future, not just of their health and well-being, but who are consciously creating the world for tomorrow. If they're healthy, their cells are functioning properly, their physiology is functioning properly. If that's functioning properly, they're thinking clearly. They can be more present. They're not anxious, and they don't have stress and other things like that built up in their lives. As a result, they can be connected, living from that place, and actually be able to create and make extraordinary difference, not just in their lives, but in the other people and the lives they're touched, as well as this planet. So for me, adjusting children is my way of shaping and transforming the future of not just health, but the actual world that we live in. So I hope that answers your question. If it doesn't, fire me an email. Call me at the Center for Optimal Living. I'm happy to expand on that and elaborate. Until next time, have a wonderful week. Be extraordinary, live optimally, and accept nothing else.